Policymakers are looking for ways to stop excessive spending on last resort programs like prison and foster care. The Maryland Opportunity Compact is a common sense approach for both investing in better outcomes for children and making the most of limited taxpayer dollars. The state of Maryland used the Opportunity Compact to fund a program that reduces the time children spend in foster care.
The Maryland Opportunity Compact is about a lot of things, but the major elements are getting the private sector involved, focusing on foster care, having a policy goal of intact families, and then measuring your progress and being able to take the dollars that you've actually saved and maybe invest part of those dollars back into additional programs that work or some other part of the budget. But what I love about it is it's children-oriented, it's about addiction, and it's about, again, quantifying programs in the public sector that really work.
The Maryland Department of Human Resources spends an average of $12,800 per year to place a child in foster care under the age of 5 who has a substance abusing parent. At an average foster care stay of 46 months, the state spends an estimated $49,000 per child. The Maryland Opportunity Compact has helped to reduce the time a child spends in foster care and ensure they can return quickly and safely to their families by funding the Family Recovery Program. The initial investment by a private partner helped take the risk out of trying a promising program. It allowed the state to test a new approach, demonstrate its effectiveness, and make a case for the ongoing investment of state dollars.
The Family Recovery Program is designed to serve children aged 0 to 5 who have never been in foster care before and whose parents have had an indication of substance abuse. What we're able to do is to reduce the time a child spends in foster care or in out-of-home placement because we're able to provide immediate and intensive services to parents to help them achieve recovery in their substance abuse addiction and to maintain that recovery so that the child could go back home earlier with that parent than what was normally found in the system in Baltimore.
You can go to parenting and go to treatment at the same time. And most of the facilities that they send us to, everything is in one. So we don't have to try to take the whole time that we did before to try to meet the criteria to get our children back.
The Maryland Opportunity Compact works. Again, it's somewhat sophisticated at one level because you have a lot of moving parts, but at another level it's very simple. It's funding programs that work, it's attacking addiction with the ultimate goal of bringing families together, keeping families intact, which really should be what government's all about.
Why policymakers or elected officials, from my perspective, ought to jump on this is because it is a almost painless intervention in that they do not have to cut any other program to fund this program. They do not have to discontinue any service to fund the program, and they do not have to raise taxes.
Through an initial investment of private funding, the Family Recovery Program demonstrated how an investment in treatment for parents would save the state money by reducing the length of a child's stay in foster care. The state then put the program in its budget. After 3 years, the total net savings per year of the Baltimore City Family Recovery Program operations was more than $1,700,000.
That's what compacts are designed to do. It's designed to allow a state to invest into a program without spending the money on the startup money, but savings happen right away. So eventually, and in all these programs, it should be rapidly, we would see enough savings coming back to us that it's really no money that's being expended by the government.
It doesn't become an argument over philosophy or even partisan politics. It's simply, we want this result. Does everybody want this result? Yes, we can get it. In fact, we can get it, we will get it, and the Opportunity Compact enables that to happen. And that's what's so gratifying about the compact, because it is always focused on the outcome, period.
You're improving outcomes, which is what government's really all about. And you're generating credibility to go to the legislature, to go to the taxpayers and say, you know what, this program works. We've improved lives. We've kept this family together. We've literally saved this child.
We don't never have to be split up again. All I have to do is do what I have to do, and we can always stay together.